A major milestone today in the pandemic. California is ending its public health emergency for COVID-19.
As of tomorrow, California and all Bay Area counties will no longer be in a state of emergency. ABC 7 News anchor Liz Kreutz has been looking into some of the changes that are coming to San Francisco. It's complicated. Liz, what have you learned?
Yeah, Larry and Kristen, it really is. We've heard actually from a group of people who are confused about what exactly the end of the health emergency means, specifically for certain pandemic-related policies. And to be honest, yeah, it is confusing. We asked the city about what this means in terms of food benefits, eviction protections, and sick pay. Here is what we learned.
It's hard to forget March of 2020.
We direct a statewide order for people to stay at home.
Now, 3 years later, the statewide state of emergency for COVID-19 has officially come to an end, and along with it, the public health emergencies in several Bay Area counties, including San Francisco.
We are about to deliver our letter to Mayor London Breed.
Kristen Urquiza is the co-founder of Marked by COVID, a group advocating on behalf of people impacted by the pandemic. On Monday, members of the group went to City Hall to demand more answers on what the end of the emergency declarations means for certain pandemic-related programs and protections.
To make sure that evictions, food banks, pay time off, all of these protections remain in place.
So will they? According to spokespeople for the city, it's not a one-size-fits-all answer.
The important thing to understand is that there are currently two state of emergencies.
One is the public health emergency declared by the Public Health Department, which is coming to an end. The other is an emergency declaration from the mayor. That one has not yet expired. That means policies tied to the health department's emergency are ending, but policies tied to the mayor's emergency, like the eviction protection ordinance, are not.
Those eviction protections are in place and remain in place regardless of the public health emergency.
So what is coming to an end? One change, sort of, is masking. The new order says members of the general public will no longer have to mask inside hospitals, healthcare and skilled nursing facilities, and homeless shelters unless the facility chooses to keep that rule. That said, the state is still requiring masking in healthcare settings, and so the city must still comply. Another change is sick pay. Prop G required private companies with more than 100 employees to offer additional sick pay for people who contracted COVID-19. That is now ending. And a third change is to food stamps. Due to changes in the federal budget passed by Congress, people who rely on CalFresh benefits will stop receiving the extra COVID-19 allotment next month.
And those CalFresh changes are not tied to the San Francisco health order, and so that does impact every recipient in the state. Other changes statewide include the closure of mass vaccination and testing sites, and that in mid-November, insurance companies will no longer be required to front the costs of COVID-19 tests. So Kristen and Larry, a lot of different changes. They also vary county by county, and that is why it can be, yes, very confusing.
As always. All right, thank you, Liz.